The world is currently facing a surge in new and serious diseases. Among these threats is the brain-eating amoeba, a highly dangerous microbe. A major concern is that many people may unknowingly come into contact with this amoeba, which can cause fatal infections with a mortality rate of 97% once contracted.
In this documentary, we explore how this disease occurs, causes death, is treated, and can be prevented. The brain-eating amoeba, scientifically known as Naegleria fowleri, thrives in warm temperatures, making its occurrence more likely during summer months, especially in freshwater environments such as rivers, hot springs, reservoirs, and lakes. These aquatic habitats serve as its primary habitats. Naegleria fowleri can also be found in water heaters, pipes connected to tap water, and roof-harvested rainwater, raising growing concerns about public health worldwide. Coming into close contact with water, often through activities such as swimming and diving, is a common practice for many people. Naegleria fowleri enters the body through the nose, typically when individuals swim or dive in contaminated water, highlighting the risks associated with this waterborne pathogen. The seriousness of this public health issue is examined through insights from physicians at hospitals. Physicians closely monitor patients' symptoms, ranging from simple to complex, to diagnose conditions promptly and initiate appropriate treatment. They utilize advanced diagnostic tools to detect damage in various parts of the body. For the brain, tools such as MRI and CT scans are commonly employed, while other body areas may be assessed using X-rays, ultrasounds, and electrocardiograms. The survival rate of a patient infected by Naegleria fowleri is typically around 3% due to the rapid progression of the infection and the difficulty in diagnosing it at an early stage. The primary issue caused by this pathogen is a fatal brain infection known as primary amoebic meningoencephalitis, PAM, which, to date, has no effective treatment or cure. According to physicians, once Naegleria fowleri enters through the nose, it travels to the brain via the olfactory nerve, where it attaches and causes severe damage. After symptoms appear, the patient typically dies within 1 to 18 days, with the average time being about 5 days. This rapid progression of the infection makes early diagnosis and treatment critical. Successful treatment of PAM is rare because the infection is often diagnosed too late and there are no consistently effective treatments available to combat the rapid brain tissue destruction. A total of 381 cases of PAM have been reported globally. Pakistan accounts for 11% of these cases. The USA reported 29 cases of PAM between 2013 and 2022. In 2024, India experienced a notable increase in PAM cases, resulting in 3 fatalities. A breakdown of exposure history reveals that 58% of cases were associated with swimming or diving, 16% with bathing, 10% with water sports, and 9% with nasal irrigation. The true number of PAM cases is likely higher than reported, possibly due to underdiagnosis, misdiagnosis, or limited access to healthcare and diagnostic facilities in certain regions. For example, in rural areas of Africa, children often swim and dive in rivers as part of a common and cherished pastime. This cultural practice is also observed on other continents. Consequently, the risk of contracting PAM among children may increase as they frequently engage in these activities in untreated freshwater, which can harbor Naegleria fowleri and other pathogens. This may further indicate that the likelihood of children being infected by Naegleria fowleri is driven not only by environmental conditions, but also by socioeconomic factors, highlighting that the risk may exist in both developing and developed nations. Mining is an important economic sector, but it can pose substantial health risks. The risk of contracting PAM among miners increases as they often dive into contaminated riverbeds to extract minerals, exposing themselves to potential pathogens such as Naegleria fowleri. The risk of contracting PAM among humans from rainfall is low, as rainwater itself does not directly cause infection. However, the risk typically increases with the use of improperly stored rainwater in tanks or reservoirs, because these storage systems can create conditions that are conducive to the growth and survival of Naegleria fowleri. When rainwater is stored in tanks or reservoirs that are not adequately maintained, lacking proper filtration or disinfection, it can become contaminated with various pathogens, including Naegleria fowleri. This is especially concerning in poor communities where infrastructure for clean water storage and proper sanitation may be limited. Water bodies hold substantial sociocultural importance. However, their use also poses risks, particularly during ritual activities such as religious cleansing. These practices increase the risk of contracting PAM among community members. The fatal brain infection caused by Naegleria fowleri presents symptoms that may resemble those of viral or bacterial meningitis. This requires immediate medical attention if you experience symptoms such as severe headache, fever, and nausea. Although a cure for the fatal brain infection caused by Naegleria fowleri, known as Naegleriaceae, primary amoebic meningoencephalitis, PAM, or amoebic encephalitis meningitis, has not yet been found, scientists are working tirelessly to address the issue. Experts emphasize the importance of preventing the disease through regular monitoring of water and sediment quality. This is particularly important as climate change is expected to lead to the wider distribution of Naegleria fowleri in freshwater environments, thereby increasing the rates of PAM infections. Naegleria fowleri thrives in conditions where the water temperature is warm, typically above 25 degrees. As global temperatures rise, water bodies are increasingly at risk of reaching the optimal conditions for the growth and spread of this free-living amoeba. Consequently, the frequency of PAM infections could rise, particularly in regions with warmer climates or poorly regulated freshwater sources. A major challenge exists in developing nations, where water and sediment quality monitoring systems are often insufficient or non-existent. These monitoring systems are typically not integrated into public warning systems, leaving communities vulnerable to potential hazards. Without such integrated systems, local populations remain unaware of the risks they face, which not only increases the incidence of infections but also complicates efforts to implement timely prevention measures.
This documentary has been produced to raise awareness among vulnerable communities about major, yet often rare, waterborne diseases. The goal is to inform the public about the risks, prevention strategies, and the importance of safe water practices. It has been created by the Center for Earth and Natural Resource Sciences, CENRS, in collaboration with Save the Land and Environment and Biodiversity, SREB.